And then obviously COVID hit. We all had to virtualize our business operations in person, over video, over cell phone, patient portal, telephone, right? And each of those things have their strengths and weaknesses and boundaries of communication.
Well, we're getting off so early. This is a hard one to get to. So I'm gonna pick up where.
So COVID, is obviously responsible for a lot of things, but during COVID, we've seen quite an explosion in technology and apps, haven't we, to do with psychiatry. Why do you think that is?
Well, I would say that clearly access was the issue during COVID, right? You couldn't see your psychiatrist or your psychotherapist, and so patients had to turn to apps as a way to get sort of augmented care or sort of substitute that care. And apps also are both those that have the technology behind it, like CBT, to actually deliver app care versus video conferencing apps that created a secure channel for you to talk to a therapist, may not necessarily be your therapist, unfortunately. And so I think the pandemic really kind of pushed technology use in mental health into the forefront because we just had to. And organizations that were able to quickly pivot to technology such as apps or video conferencing were able to then continue that care, but others had a huge pause and lag because they couldn't do it for a while plus we had to have the federal legislation to decrease the privacy issues dealing with the technology frameworks.
No, I think once people realized they could do video visits, we had the technology before. There was a little bit of resistance among both clinicians and patients. And I think once they got over that first activation step, they said, there's a whole world of apps, of asynchronous tools, and I think it did in some ways open a door that we're still very much so exploring what it will mean for the field.
Well, let's talk about that. So what kind of apps are there out there?
Well, there's thousands of apps, if not hundreds of thousands, or maybe John's of millions, I can't remember. But the bottom line is, it's kind of like anything on the internet. There's too many and it's hard to know all of them. And so I think the key is mental health apps are treating depression, anxiety, substance use disorders, even psychosis. If you think about it, it probably exists.
Right.
The key word is, can you figure out what the word is that gets you to that app? But then there's a bigger challenge, which is, as a clinician, how do you then rate the app, read enough about it to say, oh yeah, I'm gonna recommend that to you. It's like saying, hey, I'm gonna recommend to you a particular medication. I know enough about it. I don't necessarily have to use it myself.
Right.
But I've read the literature and I'm confident this will treat your condition. But with apps, it's just like a whole new ball game.
Yeah, we do have the American Psychiatric Association app evaluation framework. So it's a good resource you can Google. It's on the APA website. And it gives you some questions to ask about an app. It gives you some examples to look through. It kind of gives you a roadmap of when in this new complex landscape, because just like you don't want to take someone's word on how a certain medicine works or therapy, you want to look at the data too. And I think the APA app evaluation framework is a public resource anyone can look at and get a good head start.
That was a really interesting point you made at the beginning when you kind of said, look, there are two types. There's almost secure video conferencing and there's an app which is set up to treat a condition. But if you look at the latter, to some people that would be quite scary, right? Having an app that is treating a condition. Are they any good at this?
They're getting there. I mean, they're now what they call artificial intelligence-driven chatbots that provide some, supportive therapy and can direct you and actually call emergency if you say you're suicidal on the app. I played around with one and I had to be careful because I didn't want the police to arrive at the house. But I think that part of it is, the public is getting more comfortable with technology, right? I mean, if you remember back in the day, there was a movie called Her where this person falls in love with the operating system on his smartphone. And so we're getting there. People are getting more comfortable using technology and it almost breeds this sort of familiarity. And so who knows what the next steps are? But the question is the technology, like, the science behind it, the privacy, in the data, is it there yet? I think we're still looking at and examining. It's kind of the wild, wild west right now.
No, because we had self-help books for decades. Right. Then we had internet websites that would offer help. So clearly moving stuff off from paper to internet now onto your smartphone, it's a logical step, but we also know having self-help books did not solve the mental health crisis. Having websites didn't. So we do have to, again, ask the hard questions is this truly innovative? Just because you can put it on your phone and in your pocket, is it going to be helping you feel better? And I think that's perhaps where the innovation is. Those are the answers we want to find.
Let me ask you this though. You said there's a lot of apps out there. How should a psychiatrist go about recommending an app to a patient?
Well, my sense is, we should go to the app framework, get comfortable with that. And then John has a site that has lots of reviews, but there are many organizations that have reviews. And so I think that's one step, right? It's kind of like going to PubMed and looking at articles on this treatment and trying to decide whether that's really appropriate for the patient.
I'll say we got a donation from the Argosy Foundation, and they let us take the APA app model and make it into a searchable database at a website called MindAppsorg. And the idea is you as a psychiatrist or your patient would say, show me all the apps that have privacy. It would filter them. You'd say, show me all apps that are totally free because I don't want to pay. Show me all the ones that do CBT. So the idea is it doesn't say what app is best for you on mindapps.org. It just shows you what meets your criteria. So instead of going to the iTunes store and saying, this has the most downloads, popularity is probably not a good metric of clinical utility, but maybe asking the right questions and searching them is a better way.
I guess my last question is impossible, but what do you see the future for apps in psychiatry?
Well, I guess the fantasy could be that the app is the psychiatrist, and with the artificial intelligence behind it, able to engage the patient, then I guess conceivably they don't have to see a psychiatrist. Although I think the connection of humans, right? Because this is why I really enjoy being finally back at the APA conference, because I get energized, I have new ideas, research possibilities. I would like to think that, society, patients really want that sense of somebody is there with me, there to help me with my, burden. And so I would imagine we're not going to be replaced, but who knows?
So maybe hybrid, right? We use it to supplement care outside of our visits. I see John, he gives me therapy, helps me with medication, says, track your medication outside the session and practice this exercise. So maybe the apps augment and extend the care I have.
Thanks ever so much indeed. Such a fascinating area. Really enjoyed talking to you.
Great.
Thank
Thanks for
you.
having us.